And then here's what you should know, especially when you're looking at regular labs. Did a basic lab panel. Okay, all the test results were normal. This happens day in, day out in the POTS world. So when you get told your basic labs, and yes, I consider these basic labs, these are not in depth labs by any stretch of the imagination, they're going to be normal. Don't be frustrated. No, that's just what it is. So, what did they do for treatment? Well, increase fluid intake, start pounding sodium and salt, so 4 grams. And then they did compression stockings, abdominal binders, all of these things to help. Now, when this patient eventually followed up, what they see? Well, they saw a little bit of improvement, but still having the lightheadedness. And they eventually gave mitodrine, which is something a lot of people are used to having. They had them work on some stress responses. And at the end, they did do a little bit better. They still weren't significantly better, though. And this is the story that I see every single time I encounter a POTS patients. Maybe the medications they've done have helped to an extent, but they're not noticeably better. It's 10%, 20%, 30%. And at this point in time, they basically wrote the story as like high fives. This was good. This is about as good as we can do. Some people are even getting antihistamine. Some people are getting sent to allergists if they think there may be some MCAS. Um, for some people, they're doing birth control if they think there's anything with menstrual cycle impacting stuff. They also are given antidepressants and anxiety, right? But you see, kind of this is the extent of what it is, which is really, really unfortunate because so many people continue to struggle with POTS symptoms for months and years when this is the approach they follow.